Okay, thank you all for being here. And it's a big group, which is very nice. So what we're going to do is, my name's Hertzel Gerstein. I'm going to spend about 20 minutes giving sort of a clinical type of perspective about diabetes. And following that, we have a patient who's kindly agreed to come and answer some questions and provide her perspective. And then following that, Dr. Greg Steinberg, as a basic scientist, will come and provide a biological perspective about what we're talking about. So this is the title of the presentation, Diabetes and Accelerated Aging. Can we stop or turn back the clock? And I think you'll see as I go through the presentation that diabetes is indeed a disease of accelerated aging. And the answer to that question on the slide is yes, we can. And I'm going to try to show you some of the ways that we can do that. So, and this is the attendance code. You've already seen it before if you have the FHS ETA thing. So this is the outline of what I'm going to discuss in the next 20 minutes. So first, you can see on the thing, what is glucose? How is it regulated? And what happens if glucose homeostasis fails? Second, what are the consequences of a high glucose level? Third, what is diabetes? And how does the word diabetes fit into this whole list of terms? Can we prevent the consequences or delay the consequences of diabetes? Can we prevent diabetes itself? And can we cure diabetes, or at least put it into remission? And this is going to be what we're going to discuss for the next 20 minutes. So let's just start with the first question, which is a little bit of physiology, not from a basic biological perspective, but from a clinical perspective. And this is sort of Biology 101 or Diabetes 101 for a clinician. So what is glucose? How is it regulated, etc.? And whenever we talk about biology, we have to show cartoons. And I'll show you some cartoons which sort of show metaphorically what I'm talking about. But just to start, first of all, glucose is just a simple organic molecule. The structure of glucose is shown on the slide. It's a 6-carbon molecule in a ring form. There are obviously hydrogen and hydroxyl groups on it. And this is the most important energy currency that the body uses. So on a day-to-day basis, we use money as our currency, and that allows things to happen. The body uses glucose as a currency for energy. This is how the body moves energy around and uses energy. This is a major energy source for rapid use of energy in the body. And that's what the biochemical structure of glucose is. And the slide shows what the normal blood level, the blood level in the blood that a normal person has when they wake up in the morning, is a value less than or equal to 5.6 millimoles per liter. Or if you are used to the American conventional units and American websites, that's 100 milligrams per deciliter. And that's the normal value in a person without diabetes, without any blood sugar abnormality. Now, the chemical structure of glucose is C6H12O6. And the way that I remember that, because I'm not a biochemist, is I put it on my license plate. So if you ever see glucose driving around, then you know it's me driving, so I hope I'm not driving recklessly or doing anything, because you'll know who it is. But that is the glucose molecule. And here is how glucose levels are regulated. So when you eat a meal, that's a picture of the stomach. When you eat a meal, food goes into your stomach, and in the food there is carbohydrate. There are 3 types of foods, basically: carbohydrates, proteins, and fats. Glucose is a carbohydrate. And the carbohydrates are broken down into the building blocks, which include glucose. So glucose is one of the major building blocks of carbohydrates. So carbohydrates are broken down in the stomach and in the intestine into glucose. And glucose is absorbed into the circulation, which is shown in that red blood vessel there, which is the portal circulation, the circulation that surrounds the gut and the intestine. And glucose is taken up into the circulation where it's detected by the pancreas, which is that whitish structure. And the pancreas sees glucose, and in response to glucose, it secretes insulin, and insulin goes into the circulation together with the glucose. And insulin and glucose circulate through the blood, and that's what the G's and the I's mean in the picture. You see the arrow coming from the stomach on the left-hand side to the pancreas. That arrow represents the fact that when the stomach sees glucose and when the intestine sees glucose, it makes hormones. And these hormones are circulating in the blood, and they also go to the pancreas, and they tell the pancreas to make insulin as well. So a number of things tell the pancreas to make insulin when glucose appears in the gut after it's being digested by the stomach. And the glucose circulates, and you can see that it is cleared by the kidney, which is that big structure that looks like a kidney bean on the left-hand side or on your right-hand side when you're looking at it. So the kidney clears excess glucose if it goes above a certain level. And the glucose goes and gets taken up into the fat cells, which is the first organ up on the top right-hand side. And then below that, the muscle, and then on the other side, the liver. So glucose and insulin together. Insulin facilitates the uptake of glucose into the muscle, the fat, and the liver, and insulin allows the liver to store glucose in the form of starch, which is a form of carbohydrate. And that's how glucose levels are stored. The brain has a number of signals that go to all of these organs that modify or modulate this process. But the most important message about this whole picture is that the pancreas production of insulin is the key to normal glucose homeostasis. If you don't have a healthy pancreas that's not making enough insulin, glucose levels are not regulated. And the insulin really is the main controller of glucose levels in the blood. Without enough insulin, glucose levels start to rise. So the pancreas is the key. The pancreas is the key to glucose homeostasis. And if the pancreas is damaged, glucose levels rise, and if they rise high enough, you have diabetes. And the pancreas can generally be damaged in the body by two different broad processes. The first process, the point I'm showing right now is that if glucose level is high, what it means is, I'm just backing up a second, if glucose level is high, it means that there is not enough insulin made by the pancreas to prevent it from going high. That's probably the most important thing I'm going to tell you, that a high glucose level means the pancreas is not making enough insulin to keep that normal glucose homeostasis going properly. Very simply. Some people need lots of insulin to keep it going properly because their body might be resistant to the effects of insulin. Some people don't need so much, but it doesn't matter how much insulin you need. If the glucose level is high, the pancreas is not making enough insulin to prevent it from going high and to overcome whatever degree of insulin resistance a person may have. So there's two processes that can damage the pancreas, two ways the pancreas can be damaged so that it doesn't make enough insulin. The first broad process is autoimmunity. What meant by autoimmunity, it means that the body's immune system, the part of the body that fights off colds and infections, has decided to fight the pancreas and try to reject the person's pancreas. So autoimmune damage to the pancreas is one of the ways that the pancreas can get damaged and therefore eventually makes insufficient insulin to keep the glucose levels normal. And I'll mention it again later, but the disease due to autoimmune damage to the pancreas is called type 1 diabetes. So for the most part, when you hear type 1 diabetes, it's damage to the pancreas due to autoimmune attack of the pancreas, the immune system attacking the pancreas, damaging it. The pancreas can be damaged by other processes that we don't understand, and that's why it says other causes. We don't know why. For most people, if it's not autoimmune, we don't know why the pancreas is damaged. It seems to be, for some reason, an inability of the pancreas to keep making as much insulin as it needs to make because of, we're not sure. It could be accelerated aging of the pancreas, but we don't know what that means. It could be some toxin in the environment. There are a number of toxins in the environment that could potentially damage the pancreas. Smoking is one of them, for instance. We know that smoking can damage the pancreas and reduce its ability to make insulin. Heavy metals can damage the pancreas. There's other things that we don't even know about. So there's a bunch of unknowns. And all these unknowns that damage the pancreas is what leads to type 2 diabetes, actually. So, and we don't know the exact cause of type 2 diabetes, and that's why it says other causes. We don't know the exact mechanism. So that's the sort of overall big biological process. Now, damage to the endocrine pancreas occurs for a number of reasons that we're not sure of, but we know what increases the likelihood that it will happen. Even though we don't know the exact cause, there are a number of what we call risk factors, things that make it more likely to happen. So one of the very important risk factors for damaging the pancreas is too much energy, too much dietary energy, too much food intake. But it's not just too much food intake, it's too much food intake and not enough burning of the food. And that varies from person to person. So too much for person A might be just the right amount for person B. And nobody knows exactly what's the right amount for them. So too much for them. And there are some people who are very thin and they're still eating too much for them. And we, in fact, handle energy differently. Some people, when they have too much energy intake and not enough burning, end up putting it in their tummy. And that's called apple-shaped. They end up becoming apple-shaped heaviness. That's not good. If you're one of these people that puts excess energy in your abdomen, then you are like an apple, it's called. That is a risk for future diabetes. That's evidence that the pancreas can be damaged. There's other people who are luckier who, when they have too much energy intake, they put it in their bums. That's good. So that's where you want to put the extra energy. And if you're pear-shaped, that's actually not a risk factor for future diabetes and for future high glucose levels. So we don't understand why that happens, but that's an indication that you're putting energy in the wrong place. Too little activity goes along with energy. Clearly, if you're running a marathon every day, then eating 5,000 calories a day is not a problem. So it just depends on the matching of energy to intake. We know that screens are not healthy. Being exposed to screens, television screens, computer screens, too much increases the risk of diabetes. And we don't know why. Maybe it relates to activity, maybe it's something else. We don't know why, but somehow it damages the endocrine pancreas. We know that living in cities densely and not getting in overbuilt environments is also not good for endocrine health, or pancreatic health, pardon me. There may be toxins, and I mentioned that already, and I've already talked about smoking and poverty. There's a relationship between poverty and whatever occurs in a poor environment may be related to this. And finally, stress, whatever that means. And another risk factor that's part of this is ethnicity, that people of certain ethnic groups, certain heritage, ancestries, are more risk for damaging their pancreas. And they may have a pancreas that's more vulnerable to all these stresses. So for instance, if you're North American Aboriginal, First Nations people in Canada, their pancreases seem to be very vulnerable to these damages. Whereas if you're Northern European origin, you're less vulnerable to these same things. And we don't understand why. There's probably genetic and other things. What are the consequences of a high blood sugar level? Well, this is the most important message too. The consequences I'm going to show you, there are many consequences to sugars that are too high, but they only occur if it's not treated. So if it is untreated, the higher the sugar, the glucose level, the higher the risk of all the things on the slide. So high glucose levels increase the risk of blindness, cataracts, kidney failure, heart disease, strokes, amputations, cirrhosis even, certain types of cancers, depression, hip fractures, sexual dysfunction, imbalance, frailty, all the things on the slide. And if you look at that list for a minute, you say, these things happen as people get older. And that's why I said that diabetes is, to a large extent, a disease of accelerated aging. Since in people with diabetes, if it's not treated, if it's ignored, they happen at a younger age than they would happen in people without diabetes. But many of these things do happen in older people, not all of them. So to some extent, and to a large extent, diabetes can be thought of as a disease of accelerated aging. Now, I've used the word diabetes, but I've just told what happens when glucose levels go up. What is diabetes itself? Diabetes is a disease which is defined on the basis of a high glucose level, but it's once the glucose level goes past a certain threshold, and the threshold is on the slide. So if the glucose level before breakfast is 7 or above, remember I told you normal is 5.6. So if it's 7 or above, that's called diabetes. Or other measures of glycemia of glucose, such as an A1C, hemoglobin A1C level of 6.5% and above, is also called diabetes. And if you drink a glucose challenge, if it goes higher than 11.1, that's called diabetes. So I'm not going to go into the details about that. But the thresholds, the glucose thresholds that we use to diagnose diabetes, were chosen because they actually are a high predictor of the risk of eye disease. But even lower glucose levels that are not called diabetes, but they're still high, increase the risk of many of the other things on the slide, such as heart disease and strokes and other things. So that's what diabetes is. And I already told you there are two main types of diabetes. Type 1 diabetes, which is the autoimmune damage to the pancreas, and that only accounts for 10% of all diabetes in Ontario. And type 2 diabetes, which is all those other things, which is 90% of diabetes. And right now in the province of Ontario, 1 out of 9 adults has diabetes, and 90% of those people have type 2 diabetes. 1 out of 9 adults. In 1995, it was 1 out of 20. So the rates are going up with time. Gestational diabetes means you have diabetes diagnosed for the first time during a pregnancy. And to a large part, pregnancy just basically exposes somebody who's one day going to get type 2 diabetes. And then other types I won't even talk about right now. So diabetes, as I said, if left untreated, it accelerates aging. And this is some data to show that. This is a study of a lot of people around the world. This is actually what's called the meta-analysis of a bunch of other studies that followed people with diabetes for many years and looked at and estimated how many years of life lost somebody, and many of these people were not treated, does diabetes take away. And so in men on the left and in women on the right, the black show, well actually the height of the curve on the left shows that in a 40-year-old man, which is on the left-hand side, a 40-year-old man with diabetes can expect to live about 6.5 years less on average than a 40-year-old man with diabetes than a 40-year-old man without diabetes. And a woman can expect to live about 7 years less if she has diabetes compared to if she doesn't have diabetes. And you can see in the black that at least half of those reduced life expectancy is due to heart attacks and strokes. And the remainder are other things such as cancer and other causes that are not clear. Now, obviously, if you get to age 85 before you get diabetes, you still lose a few years, and that's shown over there, but you don't have that many years to lose, so it's not quite the same thing. But that sort of is the only real data I'm going to show you in support of the things that I'm saying. So really, it is an accelerated aging issue. Can the consequences of diabetes be delayed or prevented? Important question. Once again, those are the consequences, and the answer is yes. The treatments that we have even today can delay or prevent all of the consequences on the left-hand side of that slide, and on the right-hand side, not as well studied, so we don't know. Very, very important. That's why we talk about treatment so much, because it makes a difference. And how do we prevent or delay it? Well, the most important thing is that the person with diabetes needs to understand the disease. The one thing, how do you prevent the problems of diabetes? The patient needs to be the agent of that prevention and that delay. Because if the patient doesn't understand it, nothing's going to happen. And if the patient understands it, they are part of the solution. Also on this slide, I make a very important point. As a physician and as a clinician, people don't cause their own diseases. There's a bad misconception out there that if somebody has diabetes, they somehow did it to themselves. That's not true. There is no evidence that people cause their diabetes because of one of the 7 deadly sins or something of that nature. That's just nonsense. And that's a very important thing that we tell patients. It's a disease, like cancer, like any other disease, and it has to be treated. So they did not cause it, but they can help treat it. And by understanding what's going on. Stop smoking, number one. There's absolutely, if somebody smokes, we know that stopping smoking is one of the single most effective things you can do to prevent the consequences of diabetes, even with, or of not diabetes. But having somebody look into the back of your eyes every year, every 1 to 2 years, because if the beginning signs of blindness can occur, they can be prevented. The vision can be saved. People need to learn how to look at their feet, and that can prevent amputations. Just looking at the feet and alerting somebody if there's a problem prevents amputations. Not walking ever in bare feet. These are really simplistic things. Checking the kidney once a year to see if there's any early kidney damage, since kidney damage can be slowed down or prevented with the right types of drugs, including ACE inhibitor drugs and blood pressure lowering and angiotensin receptor blockers. Good glucose control has been proven to prevent eye disease, kidney disease, nerve disease, and heart disease, depending on how you look at that question. Good blood pressure control, and specific drugs such as statins and ACE inhibitors and ARBs. These are all things that have proven preventive things, and they actually help reduce or prevent all the things on the left-hand side of the slide and probably some of them on the right-hand side of the slide that I showed. What about diabetes itself? Okay, it's one thing to prevent the consequences of a disease, but can you prevent the disease? And the answer is yes, absolutely. Research that we've done in Hamilton, as well as elsewhere, has proven that you can prevent diabetes with physical activity and weight loss. A weight loss of about 5% of body weight. So if you're 200 pounds, that's 10 pounds. So a weight loss of 5% of the body weight, plus physical activity, a half hour a day, at least 5 days a week of walking, or a little bit more brisk exercise than walking, reduces the risk of diabetes by more than 50%. As well as drugs such as metformin, which actually also reduce diabetes by about 30%. It can be prevented. Now, people argue, well, is that really prevention or is it delay? And the answer is, if you delay it until after they die from a car accident, it's prevention. So, you know, people have these big arguments. It's actually true. They have big arguments because, well, you're not really delaying, you're preventing, delaying. It's a silly argument, you know, because you can never prevent everything. But you can delay things, and that's as good as you can get. What about cure? Can we cure diabetes or put into remission? And the answer is, we don't know. But there are some studies to suggest that if they're recently diagnosed with diabetes, that aggressive therapy may allow the diabetes to go away. And we don't know for how long, and we're actually testing that here in Hamilton. And this is a study that we're doing called the REMIT study to see if we aggressively control blood sugars and promote physical activity and dietary and other things, can we make the disease go away? That means stop all drugs. Use a lot of drugs at first and then stop them all. In other words, put it into remission. The way that chemotherapy puts cancers into remission, can we put diabetes into remission? And that's what we're testing here. And by the way, Ada, wave your hand. Ada is the research nurse who's coordinating this. So if anybody here is interested and eligible, she's the person to speak to. Finally, my last slide is a high blood sugar level and diabetes, which is past a certain level of blood sugar, is a problem that accelerates many age-related diseases, so accelerated aging. We collectively can delay this process. Diabetes may be occurring because of the pancreas aging prematurely. We can delay diabetes and maybe slow down the aging in the pancreas itself, and we may be also able to reverse diabetes or make it go into remission. And as I say, the bottom point is the most important point at a university. The future will only differ from the past if we do research. Because if we don't do research, then we never know what to do next. And we won't treat people any differently than they treated them 100 years ago. So research has brought us today, and research is going to do a lot more things over the next 5, 10, 20 years. So that's all I was going to say. And now we have a patient who's kindly agreed to answer some questions.
Thank you.
Okay. So this is Angela Harvey. So let me just ask you, you were recently told that you had diabetes. Can you tell us how you found out you had diabetes and how you heard about this diagnosis and what you were told?
Yep. So basically, as the doctor said, my name is Angela Harvey. I'm 41 years old. I'm pretty much your average everyday mom, 3 teenagers, and just a regular girl. And I noticed that in the last couple years, things were happening with myself. My feet were bothering me. They felt really sore. Maybe if some of you can remember when you'd be young people and you'd enjoy your hot day and you'd walk on the hot asphalt across the street, you'd have contests with each other, and that feeling of that stinging sensation when you got off the hot asphalt, that's what my feet were feeling like. And that was one of the things for me, and I thought, why do they hurt so much? And I was making up excuses for myself. I thought, well, maybe it's being overweight. I stand on my feet a lot for my job. I worked as a cook. So I thought, well, maybe if I just lay down, put my feet up, they'll feel better. And, we sort of put these things off. I'd gone to the doctor telling him my feet hurt, and he didn't really have a lot of response to me. He just said, well, are you drinking a lot or anything? And I said, well, sure I do. I'm the water queen. I love water. But there wasn't, are you thirsty really? I just thought, no, I'm the water queen. I love water. I don't really love water now that my sugars are normal. So I was obviously really thirsty. I continued to have some of these problems. I actually went then to see my doctor again because my feet were so itchy too. And I thought, well, maybe it's because I love the great outdoors so much. Maybe I've gotten some poison ivy because I'm always camping, I'm with the kids and the dog. But yet there wasn't a mark on me, no rash. I saw the pharmacist, he said maybe you could try some Benadryl. I tried Benadryl, that didn't do anything. So I kept itching and scratching and going to bed with my feet up on all those pillows. And the next morning I'd wake up, probably not too bad, but that was probably because my sugars had come down during the night. I also went to the doctors because I was sweating like a trooper, and he told me that I was perhaps going through the change of life, and this was part of us ladies going through that. So he suggested maybe I could take some medications that would help ease those symptoms, and I said, I really don't prefer taking medications unnecessarily. Maybe I'll just try to wait this out a little bit. So that's basically what had happened. Finally, these things just got too much for me, and it was at the end of the summer where we went to Sandbanks Park, my husband and I with the kids, and one of my favorite things to do was to always be walking the trails and enjoying the sand, the surf, etc. Sandbanks is known for its beautiful sand, powder perfect sand. I took my shoes off, beautiful warm day, I tried walking on the sand. I was almost in absolute agony. I could not stand standing in the warm sand, which is something pretty much all of us love to do, right? We like to sit there and rub our feet and it feels so great. I almost went through the roof in agony. I said, there really is something wrong. I went back to the doctors. He said, maybe we should do a blood glucose test. So we did it. I didn't ever hear anything back, which really surprised me. And I really think this is an important part of this conversation, because if it wasn't up to me, I wouldn't have gotten the answer that I heard. So 3 weeks went by. I called the doctor's office and I said, it's Angela Harvey calling. I'm calling just to get some follow-up. I haven't really heard anything. As it turned out, they lost my lab results, and that's why a call had never come back to me. So had I not pursued and insisted, hey, what's going on, I wouldn't have found out what was going on. They tracked down the lab, got my results, and said, you really need to come in. We got your results, you're diabetic. So I did go to see the doctor, and I said, what's going on? He said, this is what your results were. They weren't outrageous. I'm very grateful and thankful.
Do you remember what the number was?
It was 7.5.
Okay. That was a fasting one.
That was a fasting blood glucose test.
Yeah.
And I know that some people, when they first do that fasting blood glucose test, their numbers are sky higher. Mm-hmm. So I'm very grateful that mine really wasn't too bad. Mm-hmm. But nonetheless, obviously this had been something that was going on for years. So I was quite upset at the doctor's office when he told me that I was diabetic, and I said, what should I do? He said, I'd like you to go to the pharmacist, get a glucometer. You should check your sugar 3 times a day, roughly 3 times a week, and basically said, you're overweight. If you lose some weight, you'll feel better. That was all that I got. I felt humiliated and ashamed. I was extremely embarrassed. I was overwhelmed. There was no guidance given to me about maybe you should try eating these things. Maybe you could call this clinic, or you could call here or call there for some support or help. None of that was given to me. I went to the pharmacist, told the pharmacist that I needed a glucometer. He provided one at no charge to me. It asked me if I knew how to use it. I said yes, because also I had been doing PSW work. I said yes, I understand. I did it. He told me that there was a Lang's Farm Village close by to us where they would do some diabetes assistance to people in the community. He said I should give them a call. I came home and told my family. I was quite upset. I cried. My mom contacted her brother, who's here today. My uncle has had diabetes for many, many years. He's lost his sight. He's had a lot of his toes amputated. My uncle was good enough to contact me right away and said, "What's going on? I want to hear what's going on from you." I told him how upset and concerned and worried I was, and it was actually my uncle who suggested I call here to McMaster because he's been a patient here with Dr. Gerstein. I called and came in and became a part of the REMIT study with Ada Smith. And I can't say how grateful and thankful that I am to Ada and Jeff, my kinesiologist, my exercise guy.
Can I just ask you, so
Yep.
When you started to check your blood sugars, after you were checking them at home, before you came here, what type of numbers were you getting when you were checking them?
Before the REMIT study?
Before the REMIT study.
Before I entered the REMIT study, average numbers for me were 8, 9, 10,
Before
11.
breakfast or during the day?
Before breakfast time, it was very commonplace for me to read at 8 or 9.
And during the day, let's say in lunch or supper time?
During the day, I could get them down a little bit, maybe 7.9 or 8.5.
Were you on any drugs or just
No.
And did you change your diet at all after you were told you had diabetes?
Immediately when I found out from the doctor's office that I had diabetes, I sort of went on this crazy diet I made up for myself. I called it the starvation diet. And it did work really well in a sense that I lost 17 pounds really fast, but it really wasn't a healthy way to be doing it. With coming here to the REMIT program, I got an opportunity to meet with Rose, who's the dietitian for me. She explained different and new ways for me to look at my lifestyle and the way that I eat my meals and realize that I don't need to starve myself. I should be eating specific sizes of foods and such, and to have a great variety. And I've continued to lose weight with her guidance and with the guidance of Jeff, my fancy exercise guy. I love him. And with Ada's awesome encouragement too. In total, in the last 5 months, I've lost 40 pounds. My last A1C was done approximately 3 weeks ago now, and it was 5.7.
What were your blood sugars when you were checking them recently, a couple of weeks ago?
They've been normal.
Like what? What type of numbers?
To wake up in the morning, for me, it would be 5.1, 4.9. Lunchtime, same thing, 5.4.
Are you on any medications right now?
I am not on medications right now, as I just finished my 8-week study of the REMIT program. My numbers have risen just very slightly. I've discussed those numbers with Ada, and Ada has told me those are all normal range numbers.
Okay, this is very helpful. Are there questions from the audience for Angela? Has your energy level changed at all since losing the weight? Did you find that, or not since losing the weight, but since your sugars got better? Have you found your energy levels being better, or your get up and go?
I absolutely feel a lot better, and I'm actually glad that you asked me that question, because that reminds me, I didn't realize before. I said I was the water queen. I think I was also the napping queen. I have the ability that I work from my home as a PSW, caring for an individual. And, every afternoon we'd sort of be watching the movie quietly, almost half falling asleep together. Mm-hmm. And since my blood sugars are normal, I don't want to nap anymore. I didn't realize what an effect your blood sugars have on your energy, and how when your sugar levels are high, how they actually make you sleepy tired. So I haven't had a nap in ages. I do have a lot more energy. And also, one important thing I'd like to point out is that when my sugars came to a normal level, my feet didn't hurt anymore. And for me, that was one of the biggest things I was so grateful for. I did go and see a neurologist. I had a lot of tests done on me. He did tell me that I had some mild neuropathy, And he said that had probably been from the years of having the higher sugar ranges. And he was very supportive. He had a totally different outlook than my family physician. He understood I didn't really want to take any medications unnecessarily. So he recommended just a vitamin supplement that would help with healing the nerves in my feet, and with normal sugars, they didn't hurt anymore.
For Angela? For me? Okay, okay, quickly, yes.
How much of change of life has an effect on the hormone level to reduce the, for women especially, the change of life would affect the level of insulin?
Yeah, so menopause does not have any clear effect on diabetes. And so we know that diabetes increases as people get older, right? But there's nothing magic about the menopause. That seems to, what it does in people with diagnosed diabetes is that during the cycle, during the bleeding part of the cycle, sugars tend to be lower. During the weeks after the bleeding, the sugars tend to be a little higher. But that's basically it.
I just want to add one thing with that, talking about the change of life. One other huge thing too that changed, it was very difficult for me to guesstimate whether I was maybe experiencing a change of life or not, as a young girl at 29 had a hysterectomy. Yeah. So I would not know if I was going through the change of life. Once my blood sugars were normal too, the sweating stopped. Yeah. So I wasn't good to know I wasn't going through the change of life, and I'm not crazy. The sweats are gone.
It's very well known that people with high blood sugars feel unwell, they're tired, and one of the reasons they're tired is they're waking up at night all the time to pee, because the glucose levels go up, they cause a diuresis, they make your kidneys work harder, you don't get restful sleep, you're tired, you're not getting sleep at night, during the day you're taking naps, and then a lot of other sort of non-specific symptoms occur. You had a question for her.
Yes, I wanted to know what the supplement was that was recommended for
the vitamins?
For your feet.
To get rid of the nerve damage.
I was recommended to take omega-3, 2,000 milligram units of it. I was recommended to take vitamin D and a vitamin D6 and a vitamin E.
Yeah. And from a medical perspective, we don't know if that works or doesn't work for that, and so it's really not being well studied, but it's probably not going to hurt.
Yeah, and that's basically too, the neurologist, when he prescribed them to me, he said that basically because I was also probably very regimented in my eating routine now, very regimented. I say no to everything, but that's just me, because I want to be the best that I can be for myself, taking care of myself, because of my uncle, and I love my uncle very much. I see the struggles he's gone through. I don't want that for myself, and I want to set a good example for my kids, that because this is so genetic, and I understand that more now, because at first I thought this was all my fault from indulging too much. I want to set a good example to my kids that if you take good care of yourself, you can totally manage your diabetes and have a great life and be healthy.
Yeah. Lori.
That's a really interesting story, so thanks for sharing it. But if it sounds like you kind of presented with some maybe not so usual symptoms of the typical diabetic patient as I know it. But if you were to have some advice for like nurses or doctors that work in, family health teams or family docs offices, what would it be?
I think absolutely for sure is, especially as the physician standpoint, when you know what more of the signs and symptoms are for diabetes, really asking that patient who comes in, because when you looked at the things that were happening, my feet tingling and stinging, the sweating, saying that I was the water queen, the napping, all those signs were there. Maybe just questioning more, and maybe taking a jump on just saying, hey, how about we do a blood glucose test? Maybe asking that question way earlier, because these things happened for years. Also, while I was expecting my children, because I have 3 teenagers, I was tested actually for gestational diabetes, because when you would go in as a patient
Did you have gestational diabetes?
No, but I apparently just squeaked past where the nurse questioned me and said, "What did you eat for breakfast today?" And when I told her I had a bowl of honeycomb cereal with the other kids, I said, "Well, I had a big heaping bowl of honeycomb cereal." She then just passed it off and said, "Oh, okay." I also had babies that were 8.5 pounds, 8'11 pounds, and 9'11.
Yeah.
So really big babies. So for my doctor who's known me my whole life, I think he could have maybe paid a little bit more attention and maybe not make me feel so bad about it. Because to tell your patient, first of all, that they have diabetes, that was really upsetting. But to basically make me feel bad about it by just saying, well, if you just lose some weight, you'll be fine, without giving me any guidance or support, that would really be nice. A little bit more support, because it's pretty devastating when you hear that news.
It's very well said. Yeah.
Did you have annual checkups with your doctor to test your blood, usually annually when you're getting blood?
Actually, no, I didn't normally have an annual checkup. Thankfully, I've generally been a very healthy person. I mean, my doctor would always see me and he'd say, "Wow, you look healthy as a horse." I'd, have these big babies and do all kinds of things. And, I figured, hey, I weigh probably more than any of you guys in this room, okay? And the problem is everybody would always say you look so great that you'd use it as an excuse that there was nothing wrong. So we sometimes let those things go, right?
And remember, we don't know in our society why some people are heavier and some people are lighter, right? We just don't really know. We think we know, but we actually really don't know. And as I said before, there are some people whose whose body can't tolerate even a little bit of fat because they're genetically not able to store fat as well as other people. And so we don't understand that. Yes, sir.
Now that you have your blood sugar under control,
Mm-hmm.
do you suffer from any side effects? Do you have your blood sugar go too low?
No, I haven't had it where it goes too low. I did have it go slightly low when I was participating in the REMIT study. And, excuse me, please?
Slightly low. What numbers is that?
Well, at that time, that would have been maybe a 4.3 or a 3.9 for me. And that was during part of the program as we were adjusting my insulin level to what would be an appropriate level for me. And once a correct level for myself, my body weight, my eating habits, and my activity level, et cetera, were established, I no longer had those plummeting lows anymore. So again, a really important thing with your doctor is to make sure that you're keeping track of your patient and, keeping good logs with your patient, as Ada did with me, seeing when we had too many of those lows and saying, okay, and dealing with the dietitian, Rose, who would say, you know what, you're not eating enough carbs. You need to bump that up. You're starving yourself, and that's why you're dropping.
Just to add, this particular study that she was involved with, the treatment was a limited period of time of using insulin plus pills, and then it stopped completely. So that was the thing being tested. But once people are off medications, they don't tend to have any low blood sugar levels.
Yeah.
Any other one or two other questions? And I think we should, just maybe one or two. Yeah, go ahead.
Do you think you were physically active during your 20s or 30s?
No.
Okay.
That's the honest answer. No, I told Jeff I'm the queen of lazy. I didn't. That's the honest truth. I didn't like exercising. I was a stay-at-home mom. I was busy and active with my children, but I wasn't going to be out exercising like maybe a lot of you young people did. So,
One last question? You have the last one. Yes, sir.
A comment and a question. Stay-at-home moms are never easy.
well, thank you.
The other thing is, do you educate your family physician about all the things that you learned?
I tried. I saw him actually last week, and I think the best I got out of him was he was glad that my blood pressure was perfect, and he said he was really glad that he could finally use the normal size blood pressure cuff on me. And when I told him the results of my last A1C, he said that that would be impossible because I would be dead. So I won't be visiting him anymore for my diabetic care.
Okay.
I mean, I think you're blaming yourself again. It's not your fault, it's the doctor's fault.
Yeah.
He didn't diagnose you early enough.
Okay. Great. Well, Angela, thank you very much for
Thank you.
sharing your experience with everybody. Thank you very,
Thanks.
very much.